Hi, I'm Dr. Marshall Partington here at Partington Plastic Surgery Center in Kirkland, Washington. And today we're going to be doing liposuction, liposculpture on this great gal. We're going to be addressing her outer thighs, her inner thighs, her knees, and so-called banana roll, which is in this back area, the upper part of the posterior thigh, below the gluteal crease. Very common combination to make for a slimming effect throughout the whole thigh. I've already anesthetized her locally. She's got sedation on board, so she's relaxed. I've made very little incisions here, enough to pass these cannula, which is a blunt-tipped cannula with a lot of little holes at the end of it. And as I pass this underneath, and it's attached to a roller pump, I can put in a lot of local anesthetic, which is the lidocaine with epinephrine mix. I've done this now over half an hour ago, so this is all nice and numb now. Okay, so now here is a liposuction cannula. There are many different styles. This is one I prefer generally, a Mercedes tip. It's 4 millimeters in this setting. Sometimes we use smaller ones, and sometimes we use larger ones with baskets where we oftentimes don't use suction. That's all part of our SAFE lipo, S-A-F-E lipo system. If I step on the suction, it makes for sucking at the end of these little holes here. And then any fat that is, this cannula is passed through fat, and it clips the fat off, sucks down the tube, sucks into here, and then swirls around and goes into the canisters. So I'm about to do that now. I'll just have it off. Place it in the hole. Do a little pre-tunneling, as we call it, just so I know what the depth of that cannula is. Okay? And then when I turn on the suctioning, we'll start to see fat coming out of this tube, which you'll see in a moment. It should be nice and yellow. Okay? And this is the beauty of tumescent anesthesia, where fat is actually coming out with little or no blood at all. So we can take quite a lot of fat out very regularly like this with little or no blood loss. And that's what's going on with this. These are radial passes. There's very little resistance under her skin with the fat. We're getting a really nice confluent removal of these layers of fat that bother her. And I will be using these holes, different holes for different vectors, and that's how we get a nice smooth result. But you can see that this fat is coming up really nicely. There again, beautiful.